have a graphic that I want to share with our viewers, and if you can walk us through these. Some of these are so known and unfortunately so common.
Yes, and sometimes they don't have symptoms. They don't give anybody symptoms. For example, high blood pressure, it's unusual to have symptoms if you're hypertensive unless the levels of blood pressure are pretty extreme. So it's very important just to take your blood pressure or have your practitioner take your blood pressure. Your levels of cholesterol are important, but in families with premature coronary disease, it's also important to note that it's not just a number of particles in your bloodstream, but the type of particles, the LDL particles that are usually associated with coronary disease. If you have the very small atherogenic particles, you could have a total number of cholesterol in your blood test that looks normal or good, but if most of the particles are of the really bad kind, then it's important to identify those patients so that we can modify that risk factor.
And we actually have other risk factors, and it's the ones that you can't change, unfortunately. It comes with genetics and your family history. That's why they constantly ask you anywhere you go, do you have a history of heart disease? Do you have a history of heart attack, stroke? Is this correct?
That is correct, and it's important to note that the precursor of heart attacks and strokes is plaques in the circulation, okay, coronary or otherwise. And even as children, we already have plaques in the circulation, in all our circulation. Right. And the rate by which these plaques develop depends on your risk factors and your genetics, and also the risk of rupture of a plaque, which is what really causes a heart attack, is also dependent on the risk factors, but also on circumstances.